HPV, human papillomavirus. It's actually so common, we often don't even know that we've been exposed to it or that we may even have it. Our bodies, if we're healthy, we don't have any what we call immunocompromised states or issues, our body may handle it just like it does so many other things, and we don't even know is there. But for others, let's say we are getting screened for our pap smear, and they do what's called co-testing, where we're not looking just for the cells, but now we're also looking for this HPV virus. Sometimes that's the first indication that a person may even have or been exposed to HPV. Here's the beautiful thing with this, though. There is a vaccine, y'all. There is a vaccine called Gardasil that can help help protect you rather against many of the most common strands of human papillomavirus. And as research has gone along, we know now that HPV can be the cause of many different issues and cancers, from warts, whether it's genital warts that's present, to cervical cancer, to anal, oral cancers. HPV has been responsible for so many things, but with our vaccines, we're starting to see that trend decrease. So, not just for our ladies, but for our guys as well, starting as young as age 9, this vaccine is available for us to get to help protect us, to help prevent essentially cancer later on in life.
Hello, everyone. This is Dr. Anita Luanga. I'm here again with my friend Dr. Loretta Duggan, and we are going to talk a little bit about periods and on top of that, about some new ways to test for HPV. Thank you so much, Dr. Duggan, for agreeing to be on our show again. For those in our audience who do not know you, please introduce yourself. Tell us a little bit about your journey into medicine and what your area of focus is and where you are located.
Awesome. Well, thank you so much for having me. This is round 2, so this is exciting. Hello, everyone. My name is Dr. Loretta Duggan. I'm trained in family and adolescent medicine, and I'm also the CEO of Her Health, located in Athens, Georgia. With Her Health, we focus on helping teens and young women to confidently embrace their menstrual, their reproductive, and their sexual health, to live the life that they choose. So that is why we exist. That's why we are here. I did not think medicine would take me here, but as someone who dealt with really painful periods that were really heavy, and I did that for over 2 decades before I became a whole doctor to figure out how to treat and help myself. You don't have to wait that long. So that is why Her Health is here to help you with your period health, starting sooner than later.
I love it. I love it. We're going to jump right in. So, talking about periods, I've been hearing a lot about younger girls getting their periods or entering puberty a little bit earlier on. What are your thoughts on that? Have you heard, like, does the data back this up? I've also heard whisperings of people saying, certain ethnic groups are more likely to have their period a little bit earlier on. What is a normal age to start your period? Does it vary by ethnicity? How long should we expect a period to last? Do periods change as we get wiser, as we get older? Please fill us in.
Absolutely. So, to start off first, are we seeing periods younger in individuals, in our young ladies? And the short answer is yes. They're still trying to figure out why that's the case exactly, though, whether it's environmental factors. Is it because now we're dealing more so with obesity? Also, different stressors, different stress depending on where you are demographically, where you live. Those things can all contribute to one's period health and overall start of their periods. So, what do we call or define, say, an early period start? Before the age of 8, if they are having their cycles, that's going to be considered a little too early, and we want to evaluate that further to help them. It's called officially precocious puberty if they are already starting their cycles before the age of 8. The thing that I like to tell my parents to keep in mind is that, yes, they may have body odor, they may be starting to develop their breasts, that's sometimes some of the first things that we see. But if they're doing that and they're like 6 or 7, get it checked out and make sure that things are they progressing as they should, or are they going a little bit too early. But yes, the data does back up that periods have been starting earlier. Now it's a matter of figuring out the why behind that. So that's the first thing. Secondly, in terms of with our periods, how long, let's say, the lifespan that we're having with periods, we're learning so much more when it comes to perimenopause and menopause as well, which is just as important, not just when they're entering into puberty, but also as we're exiting as well our reproductive lifespan. So things that we're looking out for there, whether it's brain fog, whether it's issues with our moods that are starting to change when normally that wasn't the case. Are we feeling more tired and we're just not sure why? And with our periods, are they starting to skip or slow down or become heavier? These are things that we're starting to see, not just on the outset of cycles as they're trying to kind of level themselves out within the first couple of years of starting periods, but now on the back end as well, we're getting so much more information and data, thankfully, which is needed, that can help us as we're exiting that reproductive lifespan as well.
Nice, 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 nice. So I want to back up a little bit and go back to the early periods. So, say if parents feel like their child is entering puberty a bit earlier than they would expect, in addition to approaching their doctor, are there any other things that they should consider doing? I've heard, I don't know if this is true, but I've heard people talking about products that contain lavender essential oil, like certain things that might be triggering early puberty. Are there any things that parents can do or should perhaps consider avoiding? Is it perhaps the food that we're eating? Is it, you mentioned obesity? Should they be helping their child manage their weight? What are some practical things parents can do in addition to talking to their doctor about, not that they necessarily want to stop puberty, but a lot of things can come on with puberty, and having an 8-year-old who's having to manage something when they should be a child, something that's a bit more mature.
Yeah.
What can they do and how can they support their child through this journey?
Yes, that is absolutely a lot for really a teenager, let alone a preteen or 8-year-old to deal with when it comes to their periods and their cycles. One of the things that I would say is something that continues to come up all the time is lifestyle changes. Lifestyle, lifestyle, lifestyle. The one thing that we can do our best to control given our circumstances, right? Because some people may be of lower income and it's just harder to get the healthier, quote unquote, healthier foods, the fresh fruits and vegetables, as it would for others in a different socioeconomic status. So we have to keep those things in mind as well, what we call those social determinants of health that play such a role once you leave the doctor's office, right? So definitely keeping those things in mind. How active are they able to be, whether it's in organized sports or even at home? Are there free things on YouTube that can be used? It doesn't require like a full gym membership, which I wouldn't necessarily recommend for kids anyway. But we can find things that are just available to us and start there. And that would be one of the biggest ways that I would say that parents can help support their children if they're suspecting, or let's say in the family, there's a family history of early periods starting, things like that. So I would start with what we already have and then work our way from there, involve the medical team, medical staff as needed. And then the other thing is talking with your child, talking with your preteen, letting them know what to expect as their body is changing as well. So it's not a huge surprise for them. We want to keep that door open to have these conversations and starting little by little to address whether it's questions that they may have, the child may have, or if as a parent, we're just saying, hey, how are things with your classmates or anyone that you know of has started their periods? What do you know about periods? And that can open the door to, say, larger conversations when it's needed down the line. But I would say starting with lifestyle changes that are within the bounds for you and your family that can make sense. That's one of the easiest ways that I would say, well, I would say easy, but I'll take that back. That's one of the ways that we can start to help address some of the, say, obesity issues that we're seeing that are starting younger and younger. The other thing, too, looking at environmental factors like pesticides, things that are being used like antibiotics in the different foods that we're having, those things we can't necessarily control per se. That may be an advocacy at a larger level that's needed, say, governmentally versus what we can do at home. But those are things that researchers are now looking at to help them determine, okay, why are our young ladies starting their periods so much earlier? And what ways can we do? What ways can be helpful to make a safe, healthy environment for not just some people, depending on what zip code you're in, but for everybody to see if that can be a factor that can be improved on a larger scale.
That is awesome. Thank you so much for sharing that. I think it can be a very difficult conversation for parents to have, especially if their children are young and or younger than they anticipated having these conversations. And I
Right.
think the world we live in, kids are exposed to a lot of stuff. So I think it can be quite scary, nerve-wracking to start having these conversations with your children and what it means, especially if their friends are also hitting puberty and or um, things are happening that they're not aware of that their kids' friends might be doing, and hearing all of that, I can imagine is quite heavy. The other question I wanted to ask you about, so say it is determined that perhaps this individual is too young to have their period. How do physicians support parents? Like, I'm assuming there are medications. This is not my area of expertise, but I'm assuming that there are medications that may be given to some children. What are some of the medications that may be given, and what are some of the considerations you as a physician make? Are there other subspecialists you work with in
Mhm.
order to make these decisions, administer these medications, and so forth?
Yes, great question. So, what do we do now that we suspect that our child is entering puberty too early? So, you're right. There are other subspecialists as well that we want to make sure that we have on board with the gynecologist, yes, but also the endocrinologist. They're going to play a huge role as well while we're watching these hormonal levels. And if need be, helping to slow down or even stop puberty earlier than we would like. One of the things that we can see or that can happen longer term for those that are undergoing puberty too early is that they're going to be shorter. They're going to be shorter than their estimated, adult height that we would expect them to be because their growth plates are they're closing that much sooner. So that's one of the things or one of the issues that we can see. The other thing as well, thinking about the exposure over time to estrogen. Yes, estrogen has its place. It can be a beautiful thing, especially when we talk about, say, our perimenopause, menopausal folks whose estrogen levels are fluctuating or decreasing sometimes. But for our younger folks, we think about that exposure over years and decades of time. What is their risk for different cancers that can develop, like breast cancer, for instance, because of that increased estrogen exposure for much longer, for several years before their peers? So that's something that we watch and we, keep an eye on as well for our folks that are maybe entering into menarche, they're starting their periods that much earlier.
Ah, okay. Okay, that's very good. That's very good. Thank you so much for sharing that. The other question I wanted to ask, uh, would you recommend maybe having a psychiatrist or psychologist involved? This came to
Mhm.
me because I'm imagining for these children it can be quite already as a teenager it can be challenging, overwhelming, or a teen. But for children, what are your thoughts on having some kind of psychological support or even in some cases perhaps psychiatric support? Is that reasonable?
Yes, that I don't think that's ever a bad idea or thought to have potentially like psychology, therapy, possibly psychiatry if we're needing medications to help with common things like anxiety, like depression, because sometimes they can present in different ways in our younger kids. It can be more what we call somatic symptoms. So they may complain of their belly hurting or having headaches, and they've had extensive workups for many different things, but everything's coming back okay. Well, what is it that's going on further? That may can be a time where we can get those specialists as well involved in their care to dig a little bit deeper to see, okay, we started our periods, we started them early, we're developing earlier than our peers. Are we having to deal with bullying or other issues or self esteem problems because of this, even though it's something that they can't control? So, whether it's our younger kiddos, even some of my patients now that are dealing with diagnoses like PCOS, like there is anxiety and depression associated with that too, because you're concerned with, say, your fertility, you're concerned with how your overall health and other comorbidities may play into what's going on. Let's say our eating disorder people. Same way, their periods may go away. They're not getting the calories that they need. Digging deeper, I don't think is ever really a wrong answer if you as a parent either aren't comfortable or aren't sure that you can reach that deeper level with your child. There was never, I feel, a wrong answer to reach out for that additional help so that we can have kind of that third party, unbiased person to step in and really help build a stronger family unit.
Ah, yes. Thank you so much for sharing. I think this is such an important
Mhm.
topic, especially for parents who feel like they don't have the resources or don't even know where to begin or don't even want to face it. I'm sure,
Mhm.
that would be some of the feelings that a parent is having in these circumstances.
Right.
And with that, I'd like to pivot. Before we started recording, we were talking a little bit about HPV. There have been a lot of updates and changes with HPV. We were just talking about new ways of testing. So
Mhm.
maybe let's start from the beginning. For those in our audience who are like, what are you talking about? So, what is HPV? What are the consequences of having untreated HPV? How do we manage HPV? Then maybe I'll ask you a few more questions after that. We'll go a little bit more into the testing and some of the advances that have come up recently.
Absolutely. HPV, human papillomavirus. It's actually so common, we often don't even know that we've been exposed to it or that we may even have it. Our bodies, if we're healthy, we don't have any what we call immunocompromised states or issues, our body may handle it just like it does so many other things, and we don't even know is there. But for others, let's say we are getting screened for our pap smear, and they do what's called co-testing, where we're not looking just for the cells, but now we're also looking for this HPV virus. Sometimes that's the first indication that a person may even have or been exposed to HPV. Here's the beautiful thing with this, though. There is a vaccine, y'all. There is a vaccine called Gardasil that can help prevent, well, help protect you rather, against many of the most common strands of human papillomavirus. And as research has gone along, we know now that HPV can be the cause of many different issues and cancers, from warts, whether it's genital warts that's present, to cervical cancer, to anal, oral cancers. HPV has been responsible for so many things, but with our vaccines, we're starting to see that trend decrease. So, not just for our ladies, but for our guys as well, starting as young as age 9, this vaccine is available for us to get to help protect us, to help prevent essentially cancer later on in life. And so, that's the great thing about HPV, having this vaccine available to us readily so that we can essentially turn the tide on cancer. When it comes to cervical cancer, we know that like over 90%, we're approaching like 100, is caused by human papillomavirus, and more specifically, HPV strands 16 and 18. Y'all, that's in the vaccine. It's covered in the vaccine. So if you're able to complete that series, ideally before you ever become sexually active, then you have that extra layer of support for something that's fairly common that we often don't even know about or have symptoms of.
That is great. That is great. So for parents, should they be asking if they haven't been offered it? Should they be ensuring that their child is getting this vaccine? I'm not a pediatrician, so I'm so behind on childhood vaccine schedules. Or is it something that, will automatically be offered to them, as they take their child to see either their family doctor or their pediatrician?
Right. So typically, most are going to be offered typically around about 11, 12-year-old vaccines where we're doing some additional ones like meningitis, getting their tetanus, whooping cough vaccines up to date and boosted as well. So typically it's offered kind of within that group of vaccines around 11 to 12 years old. But here's the thing, I may have my 26-year-old patient coming in and they're like, I don't know if I've had it or not. So and on the one hand, it's like it's great because now it's treated like any other vaccine. Like you have it, boom, 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 it's on board. But then on the other side, I'm like, I want you to know that you got it. So you know that you're protected, from it. Personally, in my clinic, if we're doing kind of a routine gyne exam or we're catching up on immunizations, I'm asking, do you know if you've had HPV vaccine or not? And as long as they're in Georgia, I can pull up that vaccine record and be like, actually, you have. So you're good. You're covered. Or we can be like, you've had maybe 2 out of the 3 doses or 1 out of the 2 doses that's needed, depending on the age when they started, when they received their first HPV vaccine. So we can educate them so that they know the importance of getting this vaccine on board, just like with your flu shot, just like with any other vaccines that you may get, to understand the importance of this one, and two, knowing if they've completed that series or not. So, yes, typically it's offered at these well child visits, like again, around 11 or 12 years old, but some can start as early as 9 if the parents would like. It's approved starting at age 9. And then from there, as they get older, then checking with their physician or like at myself, this is what I do every day. I'm like, hey, do you know? If you don't, let's try to find out. If we're still not sure, check with your mama. If your mama don't know, then we're going to make sure we get this on board for you so you can be protected for a lifetime.
Good, 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 good. I love it. And thank you for letting us know it's a series of three. I think that's very important for people to be able to keep track of. And I think it's also good, even for me as a physician, to remember that there's usually, depending on the health system you work in, ways to keep, review these records and make sure people are up to date. Because vaccines are fantastic, but we don't want to give you stuff you don't need.
Right. If you don't need an extra dose, once you finish the initial series, you don't have to repeat it again once you're a certain age. The other thing that I would say too, depending on your age, so 15, well, younger than 15, if you started your HPV vaccine, then you only need 2 doses. But if you start at 15 years old or older, then you're going to need the full 3 doses. The thought behind that is the younger that you are, the more robust your immune system. So
Okay.
you're likely to amount a great immune response
Mhm,
if you're under 15. And then if not, no worries, you still can get it up to age 45,
mhm.
actually. So you can get this vaccine well into your 20s, 30s, 40s if you like, to make sure that you're covered, but you'll need 3 doses instead of the 2.
Ah, okay, okay. Good to know. Good to know. Good to know. And the next thing we wanted to talk about with regards to HPV, you were telling me a little bit about testing, advances in testing. So please fill in our audience in terms of, especially for perhaps the gentlemen too who are like, what you're talking about pap smears and all this. How are women usually tested? Okay, and also gentlemen, let's fill them in. How are gentlemen usually tested? How often should they be having testing? And what are the ways they can get tested?
Awesome. So let's start off with the guys because there's truly no specific test for HPV in our guys. That's the first thing, which is why it's even more important for everyone, our ladies and our guys included, to make sure that they're vaccinated against HPV, the human papilloma virus. So that's number one. Number two, for our ladies, in terms of testing, how many of us enjoy going to get our pap smear? Said no one. Okay. So, really, that is not the highlight of any woman's healthcare, but it's so important because we can catch cervical cancer early and we can cure it. Ladies, we can cure it if it's caught early enough. So that's why we have our screenings on board to start at age 21 for everybody. We're doing pap smears. That's what's recommended. And then now from 25, we have the option to offer HPV screenings alone as well. So it's a few ways that we can do it. Few ways that we can do it with our ladies starting at 21. I say 21 to about 30. Okay, we're definitely doing the typical pap smear with our speculum exam is what we're thinking about for most ladies. But as we cross that threshold over into 30, now there's an option to add in HPV or the human papilloma virus testing along with our typical pap smear cells that we're looking at too. So that's the co-testing that I mentioned earlier. If all's well, guess what? You have 5 years where we don't need to repeat pap smear, HPV screening, anything like that. In terms of updates to our screening options, now there are self-swab HPV options that are available. So let's say if the speculum is just not for you, like no matter how they try to spin it, however we try to do, whatever we try to use, it's just not a comfortable situation for you. If there's been any trauma, I think also for our people that may be transgender and they're not comfortable with their clinician doing an exam for their pap smear, this can be an option for them where they can do the swab themselves. With the self swab, it can be done in the medical office or conveniently, it can be done at home as well. You can have self swabs that are done as home testing. So, again, they're looking for that HPV, that human papilloma virus specifically. Now you may be like, Doc, you said 21 to 30. Now you're saying 30 and above. Where did the 25 come in? So with that newest update that they provided, they're saying that we may actually can start at 25 for HPV screening as well. For myself personally, I've kept it at 30 for right now, but here's the reason why. With human papillomavirus, usually if you're healthy, again, no other immunocompromising issues that are going on, then you may be actually able to clear the HPV virus on your own, the younger and healthier that you are. So, depending, again, we talk through it with my patients. I give them the option, do we want HPV testing as well as pap smear testing, or do we just want HPV testing alone? Or there's an option to just look at the pap smear, the cells, but that's kind of not the way that most people are going because we have such great tests looking for HPV, which is the primary cause of cervical cancer. And so we kind of talk through it, and based on what the patient, decides their comfort level, that's the test that we use. But as soon as we can start putting in some HPV testing, I say I'm all for it because we know that one is common. Two, we have a vaccine that can help protect from it. But three, we know that it's the primary driver of cervical cancer by far. So those are main reasons why I'm so excited about this additional way to increase the availability and accessibility to screen for cervical cancer for literally everyone. Now in the US, we just kind of proved this in 2025. Other countries, think about Australia and some others in Europe, they've already been using this test or, been able to offer, self swabs for HPV. And they've seen huge uptakes in terms of this screening test being done. So I'm really looking forward to seeing that here in the States as well.
That is awesome. That is awesome. And it's so interesting. Like I've been away from anything to do with OBGYN in terms of practice since
Mm,
med school. And I was just thinking back how they used to recommend, I think, pap smears every year. And then even when I was in residency, the numbers were like the frequency was changing. This thing is a moving target. So this is why it's so important for people to see their doctor regularly to make sure that they are getting tested at the appropriate interval. And this is why we as doctors have to keep up with continuing education and, be good at what we do, focus on what we do because things change. Like every year, things change. My knowledge on the screening, all of this, sure, I can look it up, but it's
mm,
changed too quickly for me to keep up. And then another thing, another important question I wanted to ask you, in terms of these self swab kits, how do people get a hold of them? Can they stop by their local CVS for individuals who are in the States to pick up the test, or does it need to be ordered by a doctor in order to make sure somebody's following up with the test results? Or should they, be asking their doctor? How does it work?
Yes, so I would advise patients to start with your doctor. Check with your doctor first, see if they have this test actually available in office for you to do. So that's number one. And then the second option would be there are a lot of like telehealth virtual companies that are, out and about now that may be an option so that you can have that test ordered and mailed to your home as well. If there's anything that's abnormal on your test, some companies have the option to actually have a physician to contact you directly on next steps. So that may can be an option for you as well to get this screening done for cervical cancer.
Awesome, awesome. And I'm gonna ask you one last question. So say somebody has a positive test result.
Mhm.
What does it mean? You mentioned something about people, clearing HPV on their own. Are they just going to be tested to see if they cleared it, or are they supposed to take medications? What are the next steps you usually take?
That is such an important question because a lot of people are like, "Oh my God, my test came back abnormal. I have cancer." That is not that is not what it means, which again is why we screen to make sure that we can catch things early enough before these changes start to happen that can lead to cervical cancer.
Mhm.
So we mentioned in terms of the typical screening time for doing our pap smear. And you're right, they've definitely changed. It was a year when I was coming through. Now, let's say if we're doing just the pap smear, the cytology, looking at the cells only, and everything is normal, you have a 3-year window where you don't have to repeat. But if we're doing the co-testing where we're looking at the cells and checking for HPV, or if we're checking for just HPV, there's a 5-year window if everything is normal. But like you said, what if it doesn't come back normal? What if we have some abnormalities on the cells, but HPV isn't there? That may be a time that we can repeat it, usually in about a year, that we want to look back and see, okay, are the cells continuing to change or has our body taken care of things on its own?
Mhm.
So that may be a shorter interval, usually around 1 year, that we can do to look at what's going on a little bit closer versus giving you 3 to 5 years. So that's one of the main kind of things that I see. The other is that let's say if we had a different type of cell change. Now, instead of saying a low grade change, it's showing us a higher grade of change. When that happens, we can check for HPV, see if the virus is there or not, but we may need to do what's called a colposcopy. That's a type of biopsy, essentially, just like you take a biopsy of skin sample, the dermatologist would. But in this case, your gynecologist will use special solution to highlight those cells that are abnormal and actually take a sample of the cells directly. Because what we want to look and see is that how the cells start to change so much that now we're at cancer, or are the cells actually looking okay with this closer inspection? So that's what a colposcopy can do if it comes to that point. So we always have an option in terms of how we can manage how sooner, we may can repeat the testing versus do we need to take a biopsy and then take the next steps from there.
Okay, that is awesome. That is awesome. I'm so tempted to sneak in another question, but I think I'm
Let's
gonna.
do it.
Okay, okay. Thank you for your graciousness. I am working at the opposite spectrum of ages. I have
Mhm.
more geriatric patients. So, usually we have for screening certain ages where we're no longer doing as much screening because people's life expectancy starts to drop. But I remember doing med school. I worked in Florida, and the geriatrician I was working with would continue to screen some of his patients a little bit older, then what
Mhm.
the recommended age of cutoff would be, just because of his patient's circumstances. But in general, for patients who are a little bit older, say they're grandmas and they're watching this, and they're like, "Oh, I have not had my pap smear or my pelvic exam for a while. My doctor has not called me. Is this the right thing, or maybe we're missing something?" So in general, what age do we usually stop doing these screening tests? What exceptions should, or what circumstances would be circumstances where we perhaps make exceptions and don't just follow the guidelines strictly?
That is such a great question. Again, we talk about on the way in, but we often don't talk about on the way out in terms of phasing out the type of screening tests that are being done. So, number one, first and foremost, always, what is the patient's preference and what is their level of comfort? So, I've had some ladies that were over the age of 65 where it's recommended that we say stop doing the screenings for cervical cancer, but they were adamant and persistent. It's like, I really would feel more comfortable if I had my screening done.
Mm,
That's all I need to hear. We're getting that screening done. The other thing that I would say, there is a difference between our pelvic exams and our pap smear exams.
mm,
So a lot of us often kind of put the two together. We think that pelvic means pap exam and vice versa. Not necessarily. So even though, let's say, our more seasoned, I call them my more seasoned ladies, they are saying, we're pretty much we're good. We don't want to have to go through any more pap smear testing or checking for HPV, all the things. We don't want it. Okay, understood. But there may be cases where we still need to do a pelvic exam. That's where we're looking at the actual vaginal tissue. We're checking out the vulva as well. And we are seeing, okay, are there any lesions, things there that we need to be concerned about that could be happening or going on? Or is the skin so thin? Could estrogen be something that's added to help improve, say, their libido or their intimacy? These are things that the pelvic exam can show us, not just only doing, say, a pap smear exam as well. And of course, if you have not had periods in years, and then all of a sudden you are starting to have bleeding, spotting, something to that effect, we always want to rule out any type of cancer that may be going on, because you shouldn't be bleeding anymore once you've gone through menopause and all that is said and done. That shouldn't be happening. But if it is, we definitely want you to seek care so we can get that pelvic exam done to look closer and possibly do biopsies as well to make sure that we aren't dealing with cancer, that everything is okay.
that's perfect. Thank you, thank you, thank you so much. Thank you for taking the time out of your busy schedule to talk with us and sharing your knowledge. I really appreciate it. And for those of you in our audience who would like to work with Dr. Duggan, who would, you're looking for an OBGYN, either for yourself or somebody that specializes in adolescent medicine and adolescent health, we will be sure to link her website below so that you can find her. And I guess that's it for today. Happy holidays if you celebrate. And bye for now.
Perfect. Bye. Thank you so much for having me. And please reach out to me on social media at Loretta Duggan MD if you have any other further questions, concerns, or if you just want to check out what it is that I do. We would love to help you.
Bye bye.
Bye.